I'm Dr. Niti Pall, Chief Medical Advisor for WellTech, part of Healthcare Catalysts. So the three global trends that I see in healthcare is rising consumerism, an aging population, reduction and a severe shortage of the healthcare workforce, and finally increasingly new innovations and technologies that are increasing the cost of healthcare. Emerging models I see across the world, particularly in mature markets, are trying to find affordable solutions for healthcare. That is trying to find cheaper ways to deliver healthcare, and that's with finding new ways of working with patients, particularly on chronic diseases, really starting to engage patient populations in a different kind of way. A technology's application to teach and train non-doctors and nurses in the healthcare arena, and then finding technologies that deliver diagnostics in smart and accessible ways. So the global trends I've seen are in three broad buckets that I find this. One big broad bucket is around patient engagement, and I alluded to that before. It's things like patients taking their own disease management in their own hands. There's a company called My Sugar, run by 4 type 1 diabetics, which is the area I'm very familiar with. Another one called the Looping Community, Omnipod, and Tidepool. They're partnering together where patients are designing their own healthcare outcomes as well as their own healthcare solutions. The second trend I see in startups is in disease management. So chronic disease management, diabetes, hypertension, heart failure, and a whole bunch of other mental health issues, a lot of new care management programs. And then thirdly, diagnostics and diagnosing patients in their home, on their bedside, in affordable ways. I'm finding startups really starting to get there, and biotechnology is contributing to this. So I think I've always been an entrepreneur all my life, and I've innovated in healthcare systems wherever I am, whether in the UK NHS, where I ran the largest chain of primary care clinics in the country, to where I am today working in universal healthcare and with many governments across the world. I find that particularly young people and people that are doing innovation give me a lot of energy, and I find it keeps me young and alive and up to date with what's happening in the world. So I'm Chief Medical Advisor for WellTech. It's a bunch of young entrepreneurs that have come together. I help put them together. Most of these people are associated with me in some shape, size or form. And I met venture capitalists here in India and wanted to partner with them because they have such a great track record. With Healthcare Catalysts, the idea came together because we have deep clinical expertise. I have clinical expertise spanning 30 years. I want to use it properly. We have deep technological expertise, serious technological expertise that we've developed in many countries, working across Africa, UK, and in India. And then finally, a commercial expertise that has come together with venture capitalists being our partners to bring together a health ecosystem and a proper incubator that just does health. It hasn't been done in India before, and that's why I made that transition into working alongside of these very impactful startups that I'm involved with. And also, I find that mentoring startups gives me personally a lot of energy, and lots of people come to me informally to do this. So informally, I'm mentoring about 12 startups already. I thought I wanted to formalize it into something that creates more impact. So I see the future in India is very bright for healthcare. The supply chain has suddenly opened up, and that's opened up because of the Ayushman Bharat and the huge benefit that people are going to get from a universal healthcare coverage, where government is going to then be looking for affordable solutions for healthcare. So I see the future very bright in India. I see the supply chain very good. It's a long journey. It's not going to happen overnight. If this is you think is going to happen in 2 or 3 years, most countries have taken 20 years to get to universal healthcare. So it's a long journey. You'll try and compress it, but you need a supply chain to follow. It's the greatest gift any country can give its citizens is primary healthcare. If you don't have primary healthcare, you don't get great outcomes. For about 80% of all consultations in the UK will be done in primary healthcare, with 20% of the spend that's done. So it's a very cost-effective way of managing your healthcare system. Okay, so in 5 years from now, I see a very dynamic, very buzzing supply chain that's going to happen here. You're going to find many more new models of care emerging in India. And my prediction is that there will be low-cost, affordable, accessible models that will emerge in India, because that's what India does. And then you will find many more international companies that will want to come and play here. So I think it's a very dynamic market. I think the future is bright in the next 5 years if we get it right in terms of the financing and we stick with it. So Ayushman Bharat is probably the greatest gift your country, your Prime Minister could have given you. It is a universal healthcare scheme. I would have liked to see it for everybody, not just for the poor. It's financed very well. It's got a great benefit design. I think the proof of whether Ayushman Bharat will succeed will be dependent on whether the supply chain and providers can meet the challenge. I think India will show the world where to go with this in terms of new models of care. It'll also, new affordable models will emerge for India for Ayushman Bharat because the government is determined, I think, to deliver on this promise. Again, my prediction is that the next decade is going to be about a workforce crisis in healthcare, not just in India, but across the world. There's a huge skill gap in India particularly, not just on doctors and nurses, but for other staff that make up your healthcare system. Physiotherapists, optometrists, speech therapists, your phlebotomists, your staff that look after your front-end systems. All of that, there's a massive skill gap. You're going to have to find innovative solutions for that, and India can rise to the challenge, I think, but you need to get your skates on today.